Thank you for joining me today. We will delve into part 1 of the Medical Staff Bylaws, specifically focusing on the qualification requirements and roles of medical staff. I have organized our lecture to cover all the key points and provide you with a clear and comprehensive understanding of this important topic, qualification requirements for medical staff. Now, let's discuss each category. 1. Interns, those who have recently graduated from medical college. 2. Residents, for Saudi residents, they should hold an MBBS degree and have completed 1 year of internship. Non-Saudi residents who graduated from foreign medical schools must meet additional requirements, including 1 year of experience in an academic or recognized teaching hospital after completing their internship. Exceptions may be considered in special cases by the hospital director. 3. Senior registrar or specialist. Candidates should meet the same criteria as residents. Additionally, they should be board certified in their specialty by the relevant board or hold a master's degree with 2 years of study and 3 years of experience in a recognized hospital after obtaining the master's degree. Each candidate will be evaluated individually. 4. Consultants. In addition to the specialist criteria, consultants should have a minimum of 3 years of experience after obtaining relevant board certification. Each candidate will undergo a personalized evaluation. 5. Head of the department. They should possess the appropriate experience and education, including relevant board certification. They should also have a basic understanding of quality management principles and adhere to relevant rules and regulations. Now, let's move on to the membership categories. Full-time medical staff. These medical staff members are responsible on a regular basis for the care of patients within the hospital, including emergency care and consultations. They have defined clinical privileges, serve on medical staff teams, and attend medical staff meetings. Visiting medical staff. Visiting medical staff are those members of the medical professions who are invited by the hospital to provide patient care, teaching, or research. They shall be granted privileges similar to permanent medical staff, with the exception of admission privileges. Temporary or locum medical staff. Temporary and emergency appointments can be made by the Director General only after due recommendation. In these cases, temporary privileges will be granted according to qualification and experience. This status applies to medical practitioners appointed to the medical staff on a locum basis. The medical director, based on the recommendations of the Credentials and Privileging Committee, shall grant all the clinical privileges recommended by them. Trainee staff. Trainee staff include interns, residents, fellows, or any other individuals who are trainees. Except in the case of rotating interns, trainee staff shall be assigned to a specific clinical department and shall be required to meet the educational and training standards of that department. Interns shall be required to meet the educational and training standards required by their medical school. Now, let's explore the roles and responsibilities of all levels of medical staff. Interns. Interns report to the head of department or the consultant in charge and are qualified physicians in pre-registration clinical training. They have responsibilities over patients under senior colleagues' direct supervision, taking instructions and being answerable to them. Interns are required to take on call duties and attend teaching programs as stipulated by the department's senior members. The department conducts monthly assessments of interns, and they write patient histories, perform clinical tasks, and assist in medical procedures under supervision. Importantly, interns are not allowed to prescribe drugs. All prescriptions require a senior physician's signature and stamp. Residents. Residents' duties extend to wards, clinics, specialties, and on-call duties. They are answerable to the head of department, consultants, specialists, and other residents assigned by the head of department. When on call, They are required to reside in the hospital. Senior registrar or specialist. Senior registrars and specialists work under a consultant's supervision in patient care and training of junior staff. They can admit patients under their name when adequate consultant cover is not available, and their privileges are delineated by the head of department. Consultants. Consultants provide specialized investigative and treatment services to patients in the hospital. They run specialty clinics, organize and supervise specialized procedures, and provide consultory services. Consultants also play a vital role in teaching, training, research, and improving patient care standards. They work in close cooperation with the head of department. Head of the department. The head of the department has various administrative responsibilities, including coordinating and directing the professional activities of specialists and other physicians in the department, supervising inpatient and outpatient activities, and ensuring the quality control of the department. They also play a key role in implementing hospital policies and procedures, evaluating physicians, and serving as a liaison with administration and other services. The head of department monitors admissions, defines medical staff. In conclusion, today, we have covered the qualification requirements and roles of medical staff. Understanding these requirements and roles is crucial for effective healthcare delivery and ensuring the highest standards of patient care. Thank you for your attention, and I hope you found this lecture informative and insightful.